Well, I appreciate everyone coming tonight. Normally I say good morning or good afternoon. It's actually good evening, and it is a good evening for Michigan. I want to thank everyone for coming together. We've got so many great people from our healthcare profession, from our legislature, from the departments, because this was about a great team effort that took place tonight and has been going on for some time. It's about Healthy Michigan. And Healthy Michigan is an opportunity for all of Michigan to benefit. And so I'm very pleased tonight to announce the Senate has passed 4714, and we are going to move forward. Looking forward to the House taking it up next week, and it's an excellent opportunity. And what is Healthy Michigan all about? It's about helping 470,000 Michiganders have a better life. Going to the ER for your health care, while we have wonderful people in the ER, is not a good solution in terms of quality of life, in terms of life for all of us. And so now we're going to have an opportunity, hopefully with House passage, to move forward in terms of taking care of many hundreds of thousands of Michiganders. And we all know someone that falls in that category. Hardworking people, but lower income people that couldn't afford health insurance. The second piece I want to share with everyone is this is something that I believe will be good for all of Michiganders in the sense of reducing costs. Uncompensated care is a terrible answer for Michiganders in terms of health insurance costs. We pay for that today. And if you look at it in a simple metric, what's better? To have someone forced to go to the ER and how expensive that is versus seeing a primary care physician and doing preventative care. It's a better answer. The third piece I would add is really the features that we put into this plan, Healthy Michigan, which had broad bipartisan support from the House when it passed. And that's really the point that this is not generic Medicaid expansion. This is a Michigan version that talks about personal responsibility, that talks about wellness. We have one of the best managed plan histories for Medicaid in the country, and we should be proud of that, and we can continue on that path. So in many respects, this is a win for all of us. I also want to say it's important that we respect one another through this process. This was a very contentious process because if you looked at our country, the Affordable Care Act has probably been one of the most divisive issues that our country's faced in the last few years. And many people do have strong opinions, both for and against. I just ask that all Michiganders step back and look to say, this isn't about the Affordable Care Act. This is about one element that we control here in Michigan that can make a difference in people's lives, and a sincere difference in their lives. So I want to thank all the people that made this happen in terms of the support. Again, we're not through with this process. We still need to go to the House, but this was a huge step tonight to get passage in the Senate. And I want to thank all the senators that supported this. It was a bipartisan effort in the Senate to make this happen. And I want to say thanks to people on both sides of the aisle for stepping up to bring this to closure in the Senate. In particular, I want to introduce our next speaker, who deserves a special shout out for being a truly stand-up individual. He's done it in so many other cases. And usually I'm standing here when we're doing a budget. So it's great to have an opportunity to stand here on this important issue. I want to recognize Senator Roger Kahn for his hard work in terms of his leadership in the work group, of being a consistent advocate, of being a tireless advocate, for being someone from the healthcare profession that understands both the human element and the financial elements of why this is so important.